Hi, this is Brass Check. We're recording this on August 18th, 2021. And at the risk of being called a Chinese collaborator, I am going to read a really interesting article from the China Daily that came out a long time ago. Looks like, oh, not that long ago. No. You know, when they move the dates around, sometimes it's hard to read. This came out in July. But it does the thing that we are not allowed to do apparently anymore, which is to ask questions. And here are the 9 questions that regarding COVID-19 the U.S. should answer. Why did the U.S. close Fort Detrick? On July 2019, the U.S. Centers for Disease Control and Prevention, CDC, issued an order to halt research at Fort Detrick. Did you know that? That's remember, if you're losing track of time, we were okay in 2019. Gates had his little exercise in the fall of 2019, and next thing you knew, January of 2020, we were on the COVID roller coaster. So anyway, in July of 2019, Fort Detrick was closed, or at least the research wing. That seems unbelievable, but that's what they're saying. At almost the same time, a respiratory disease of unknown cause was reported at a retiree community about an hour's drive from the research base, and several thousand cases of pneumonia with symptoms extremely similar to those of COVID were reported in several states in the U.S. And apparently the CDC will not give the reasons for the closing of the research because of national security. So that's question 1. And I got to confess, no idea that Fort Detrick had closed its research. Question 2. What did the U.S. do at its more than 200 biological labs scattered around the world? The U.S. has more than 200 military biological laboratories in 25 countries and regions, including Ukraine and Afghanistan. A USA Today investigation showed that since 2003, hundreds of accidental human contacts with fatal microorganisms have occurred in biological laboratories. And the diseases later developed into pandemics in the local communities. In 2020, Ukrainian lawmakers issued a statement saying that after 15 U.S. military biological laboratories were opened in the Ukraine, a variety of infectious diseases broke out in the country. So that's pretty interesting. We have 200 of these military-grade biological laboratories. What are they up to? The U.S. is the only country in the world that refuses to ratify the Biological Weapons Convention Protocol, which includes a verification regime. Okay, question 3. The U.S. Department of Health and Human Services ran a scenario last year that was similar to the COVID-19 outbreak. Is this just a coincidence? So from January to August of 2019, that's a long stretch, 8 months, the U.S. Department of Health and Human Services ran a scenario called Crimson Contagion that simulated a fictional outbreak involving a group of tourists visiting China. They became infected and flew to various countries, including the U.S. Then in October, of course, we had the famous Event 201, that's October 2019, which was hosted by Bill Gates. And by the way, the purpose of that drill was not medical or even scientific. It was to discuss what kind of draconian measures were going to be needed if we had a global deadly pandemic. That's what that Event 201 was all about, Event 201. Question 4. Among the reported influenza deaths in the U.S., can the U.S. clarify how many had actually been infected with COVID-19? Between December 13, 2019 and January 17, 2020, researchers from CDC tested more than 7,000 blood samples collected from 9 states in the U.S., 106 of which contained antibodies to the novel coronavirus. And then in beginning of 2020, NIH collected 24,000. 9 of them had novel coronavirus antibodies. I'm not sure what they're trying to get at here. When did the novel coronavirus first break out in the U.S.? Among the reported influenza deaths in the U.S., how many were infected with COVID-19? I don't really know where they're going with that question. Question number 5. Who from the Wuhan Institute of Virology with the Chinese Academy of Sciences went to the hospital in November 19 as the U.S. media reported? The U.S. media reported, the Wall Street Journal cited an intelligence report saying that on November 19, 3 researchers from the Wuhan Institute of Virology sought hospital care. The report said their symptoms were consistent with COVID-19. However, when China asked the U.S. to disclose the names of these 3 researchers, the U.S. refused to do so. Since the U.S. claimed that the source of the information was reliable, why hasn't it announced the names of the 3 people? So this is interesting. So the story that the virus started in China began with a Wall Street Journal article and was generated by a U.S. intelligence report. They said 3 people went to the hospital and nobody can come up with the names, according to this China Daily report. Okay, question 6. The U.S. claimed that it started developing a vaccine against COVID-19 on January 11th, 2020. How did it get the virus strain? Experts immediately raised questions about the speed of the vaccine development, saying that it would not be possible unless the U.S. had obtained virus strains from very early on. That's a question. How did they get those virus strains so soon? Why are U.S. experts not allowed to discuss COVID-19 in public? That's a good question. And we certainly know several scientists and government health officials, including the nation's leading infectious disease expert, Anthony Fauci, have been warned, censored, and or threatened by the U.S. administration for making science-based statements. Even Fauci's under attack. Why did the U.S. ignore the research results regarding the origin of the novel coronavirus? I don't know where that one's going. Question 9. The U.S. has made further efforts to investigate the origin of the COVID-19, but why did it ask its intelligence agencies to do the job? Why not scientists? That's a really good question, because you can count, I guess, on intelligence agencies to give you the answer you want. So it's just interesting. China is certainly not a place with clean hands, but they are asking some legitimate questions here. And it's fascinating that that Fort Detrick was closed in 2019. The research wing was. And I want to check this to make sure that the first assertion made by China is accurate, because we're told the Chinese do nothing but lie. But here we go. August 2nd, 2019, Fort Detrick Lab shut down after failed safety inspection. All research halted indefinitely. I'm going to read a little bit from this article. All research at a Fort Detrick laboratory that handles high-level disease-causing material, such as Ebola, is on hold indefinitely after the Centers for Disease Control and Prevention found the organization failed to meet biosafety standards. Then there's a little paragraph, probably inserted by the Public Relations Department of Fort Detrick. No infectious pathogens or disease-causing material have been found outside authorized areas at the U.S. Medical Research Institute of Infectious Diseases. U.S. Army Medical Research Institute. The CDC inspected the Military Research Institute in June, and inspectors found several areas of concern in standard operating procedures, which are in place to protect workers in biosafety level 3 and 4 laboratories. Spokeswoman Carrie Vander Linden confirmed in an email Friday. The CDC sent a cease and desist order in July After the USAMRIID, that is the U.S. Army Medical Research Institute of Infectious Diseases, received the order from the CDC, its registration with the Federal Select Agency Program, which oversees disease-causing material use and possession, was suspended. That suspension effectively halted all biological select agents and toxin research at USAMRIID, Vander Linden said in her email. This is pretty serious, folks. The Federal Select Agency Program does not comment, of course not, on whether a program such as USAMRIID is registered and cannot comment on action taken to enforce regulations, Catherine Harbin, a spokeswoman for the CDC, wrote in an email. The suspension was due to multiple causes, including failure to follow local procedures and a lack of periodic recertification training for workers in the biocontainment laboratories, according to Vander Linden. The wastewater decontamination system also failed to meet standards set by the Federal Select Agent Program, Vander Linden said in a follow-up email. Vander Linden could not say when the laboratory would be able to continue research. USAMRIID will return to fully operational status upon meeting benchmark requirements for biosafety. This is interesting. They've been working on USAMRIID has been working on modified biosafety level 3 procedures and a new decontamination system since flooding in May 2018. All right, here we go. At the time of the cease and desist order, USAMRIID scientists were working with agents known to cause tularemia, also called deer fly or rabbit fever. They were also working with the plague. They were also working, the big one, the plague. They were also working with Venezuelan equine encephalitis, all of which were worked on in a biosafety level 3 laboratory. Researchers were also working with the Ebola virus in a biosafety level 4 lab, Vander Linden said. Of the pathogens, Ebola, bacteria Yersinia pestis, which is plague, and bacterium Francisella tularensis, which is tularemia, are on the list of the Health and Human Services select agents and toxins. The 3 are considered Tier 1 agents, which possess a severe public and health safety threat. The Military Research Institute is looking at each of its contracts to see what will be affected by the shutdown. USARMIID work outside the lab is not expected to be affected, including on Ebola, Vander Linden said. And it goes on and on and on. So in fact, the very first assertion in this Chinese article is absolutely correct. There was a major shutdown at Fort Detrick in July of 2019, did not get reported until early August 2019. So anyway, questions not being asked, news not being reported. Speaking of news not being reported, hardly anything gets reported these days unless you're listening to Brass Check. And we can always use help with our server bills, our email bills, and our tech helper bills, which are every month. It's a free service to you, but not free to us. And if you're a paid subscriber, we appreciate it at any level. If you're not, you might consider becoming one. You're not only paying your own way, but you're also helping other people get the news they're clearly not getting anywhere else.